Welcome, everyone. We'll get started here in just a second. It's nice to see some familiar faces. Welcome to our first Words Matter session in the Words Matter series. My name is Millie Sweeney, and I am part of the National Training and Technical Assistance Center that is operated by CARS, and I am with Fredla, who is one of the partners in InTech. And Fredla is the family-run executive director, Leadership Association. I'm glad that everyone joined us today. This is the kickoff to a 12-month series, once a month, where we're going to dive into some particular terms. Words matter. Words change the tone, the frame, behavior. Words can even change practice. So the adage of sticks and stones may break my bones, but words will never hurt me is not really true. Words can hurt, but words can also heal. So welcome again to the Words Matter series, where we engage in open and authentic discussions about the impact of common terminology used in child-serving systems with those that are directly affected. Our goal is to illuminate how terms we use can influence perception, influence our approach and practice, as well as explore alternative language or terminology as a means of intentionally shifting how we view and how we interact with youth and with families and with each other. Today, we'll be exploring the term system of care. Before we begin, I'd like you to please take a moment to consider this term, system of care. Think about what comes to mind when you think of system of care or systems of care. And then using the link that's in the chat box, respond to the Menti poll with the thoughts and the perceptions that come to mind when you hear this term. I'm going to give everyone a second to respond to that. See on the screen, if you are not getting the link in the chat box, you can go to www.menti.com and use the code that's shown there, 6879-9291. What we want to do is have a word cloud come up. Everyone getting the link? There we go. So try not to put them in the chat box, but try to put them in the poll. You go to that link, that way they'll show up. The full code is 6879-9291. Get some words popping up now. So when you think system of care, systems of care, community is one that's really popping up now. Systemic racism. One system. Resources. loss of choice, coordinated, collaboration is also one that's showing up. I wish they had a couple more terms. Right now, collaboration seems to be the one that people are using the most. It's the term that comes to mind. Silo interference. That's interesting. Team. Thank you. This gives us an idea of what the larger words that show up on the word cloud are the ones that are the most commonly used by everyone that's here today, the most common thoughts that come to mind. The word cloud shows those things in the largest font. And so based on the word cloud, you can see what some of the most common perceptions are. Collaboration and community and support are showing up. But you can also see that some people start thinking of systemic racism or silos, loss of choice. So we all have a little bit of a different frame, a different perception when we think of the term system of care. Thank you, Joanne. So let's talk more about how the term system of care impacts youth and families. Joining us today, we have three discussants. Jax Kuma is a young adult active in York County, Pennsylvania System of Care Governance Council. We have Rainey Williams, a parent from Oregon who has also used her lived experience in peer support, and Catherine Brocchiello Hagee, project director for the federally funded System of Care in Philadelphia, Pennsylvania. Thank you all for being here, for sharing your experiences and perspectives with us today. So we're going to dive into the discussion. The first thing I want to ask you guys about is about system of care overall. The term system of care has evolved over the past few decades. It was conceptualized by Beth Strohl and Robert Friedman as a framework with the values and principles to build coordination across systems through partnership between youth, families, providers, and systems. The core of this philosophy is to work with youth and families to develop effective pathways to services and supports that really fit them the best. With the infusion of funding from SAMHSA, which is the Substance Abuse and Mental Health Services Administration, and that's a good thing. Funding provides opportunities to establish the foundation for a comprehensive coordinated system. But with this infusion of funding, it's often seen as a program that is owned by an entity that's receiving the grant. The term system of care has also been intertwined with wraparound, which is a model of service delivery that's often used within a system of care and is not a system of care itself. So after many years, there's still confusion about what system of care is and means, and this can impact both families and providers alike. So Catherine, I'm going to start with you. As a project director for one of the federally funded sites, what does system of care mean to you, and how do you use that term?
So we are the recipient of federal funding, but it's so much more. System of care is so much more than a project or a grant site. For us in Philadelphia, it's really an opportunity for us to operationalize the values, youth and family-driven care, community-based, culturally responsive. I think most people, when you hear that, you're like, yeah, I'm on board with that, right? That is, in line with best practice, strong values. But what does it look like in practice and actually operationalizing those values? That's where the real work is. And so the grant funding gives us the opportunity to try out, new and innovative practices, and enables us to be able to build infrastructure to bring youth and family partnerships, to either create them, to develop them or expand them, to strengthen them, but really how we infuse that throughout our system. the long-term goal here, it's not just to impact the youth and families that are served through our grant program. It's really, much larger of how do we impact the youth serving systems here? How do we do that in a way that's sustainable and changes the way that we do business, so that at each level we're authentically partnering with youth and families around their needs, their strengths, and what they want to see in their community. So I think you mentioned at the core of this is really partnership with youth and families, and it's not only at a direct service level. So high fidelity wraparound does that beautifully, but that system of care doesn't stop there. There's also, the programming and organizational level, how we support the development of peer support, family organizations, et cetera. And then our governance, so where we take our guidance and our direction from within system of care. At Philadelphia, we have a county leadership team that fulfills that function, and it's made up of families, youth, and our system partners. So it's really having that partnership across all levels to impact change in a sustainable way. That's what it is for me.
Mm-hmm. Yes, it really is about that seed money to make those long-standing changes and doing that in partnership. Thank you for pointing that out. Jax, you've also been involved in a federally funded site. So how would you describe a system of care, or how have you seen it used in your community?
I would describe system of care as a framework for communication between different systems. Something I've seen in the different meetings I've been in is more communication between different systems that don't seem to have talked to each other in the way that they do now before the system of care brought them together. And I see it as having a lot of potential, because in these governance council meetings, we are able to bring up issues from individuals. For instance, we had a story of someone who had accessed a crisis service. More accurately, she had tried to, and she had called them, and they had not been able to send her the help that she needed in the way that she needed it. And we were able to look at that and see what the root problem of that was and where we might be able to help solve that kind of issue. Mm-hmm. And unfortunately, I've been going to a boarding school outside of the county I work in, so I haven't been able to see it in my community as much as I would like to. But one of the initiatives we've had that, as far as I've heard, has been doing really well is bringing police and mental health services together so that we can have mental health professionals helping when there's a crisis that police might not be equipped to handle.
Mm-hmm. Yeah. So it's really trying to get down to solutions and making things run better, and having those that use services say, this works, this doesn't work, so that you can make a change so they can access what they need when they need it. Thank you. From a parent perspective, Rainey, what does this term system of care mean to families of children and youth who are navigating mental health and other services?
In my experience, systems of care, so my children have been involved in wraparound services for a very long time. Systems of care was actually something that I didn't even hear until I worked for an agency that was part of systems of care. And so from a parent perspective, when I hear systems of care, it's a very ambiguous term. It's a lofty idea of things that are potentially out there, but it doesn't directly connect with my experience. So in the word cloud, when I read silo, I just thought about that, because as a parent trying to navigate systems, you're given one piece of the puzzle at a time, depending on what your child qualifies for. Systemic racism was another thing that jumped out to me, because as a parent, when you hear system, I have a full body response, and my response just to the word system isn't very positive, because there are certain systems that I've had to work through as a parent that maybe didn't go so well. So to me, systems of care, now I have a better understanding of it, but when you're navigating services and you're kind of doing one piece of the puzzle at a time, it doesn't connect as to this big lofty idea into what you're living and what you're going through every day. I know in Oregon, systems of care isn't something, it's not a term that's really used when we talk about the different services, unless you're in an agency that's part of it. So in wraparound, working with clinicians, working with life skills trainers, they don't reference their services as part of a system of care either. So that has been my experience navigating through different, clinical teams and providers and different services that are here to help families.
Yeah, and it really, that goes to the whole idea that Stroll and Friedman came up with, is we shouldn't have families have to put pieces together themselves. We should help, and we should be working with each other. That philosophy, and with it being a lofty term, if it doesn't trickle down to everyone who is involved on the ground, in the field, receiving services, providing services, so some of that connection can happen. As you can see, the way in which a term is defined and used can impact people differently. And we definitely saw that in the word cloud, and all three of you pointed that out. So tell me, what impacts have you seen or experienced based on how system of care is defined, or when the term is either used or not used in your area? That's open to all three of you. I believe, Catherine, you had mentioned you were taking sort of a different approach in one area, using different terminology, the same philosophy, but maybe thinking of a different way to say it.
Yeah, definitely. And actually, with the word cloud, somebody had popped up, more of the same, right? And I think that's the potential pitfall that sometimes we don't want to fall into, the more the same. I've worked in a few systems that have implemented system of care, and some folks, for some folks that had prior experiences, the phrase or the term system of care actually left a bad taste in their mouth. And so, it really caused us to think about, how do we shift away from not necessarily this fixed mindset around the terms, but really looking at how do we change practice, and how do we focus on the values in practice. And so, within Philadelphia, I think our families and youth, when we've had conversations around systems, systems can feel really mechanical, right? Impersonal, a number, a case, a cog in the wheel. And that's not something that we want to portray with system of care. So we've been talking much more about community of care, creating communities of care in Philadelphia, because it's about the people, the relationships, and the community. And so system of care doesn't necessarily jive with or have resonate the same way that community or partnership does.
Mm-hmm. That's true. As has been pointed out, the term system or systems does have a negative connotation for some people. For others, it makes sense. You want a coordinated system. You want things to be connected. There's a systemic way of doing things, but it does depend on how it's defined and those who are involved. Jax or Rainey, do you have any comment about that? About how you've seen the impact of this term being used?
I would say, because in my own experience, system of care wasn't a term that was used. I think having an understand from a family perspective, and as a mom, having an understanding of the services that are available and that work together to serve my family, I think that's helpful. It brings me back to when I very first started services and how overwhelming that was, because when you very first enter into services as a family, you have a lot of voices coming at you, telling you very different things, and every system, or provider or team or things like that does have different requirements and different things you have to do, and different expectations as well. So when I think about, if I would have had a conversation at the beginning about systems of care where it really connected for me on, this is what's available to you, these agencies are here to help you, would that have been helpful or more overwhelming? Because there are also some systems that you're not eligible for until you're at a certain point in services as well. So I know for myself that when I started understanding that there's a bigger connection and collaboration of these agencies that work with families, it was very helpful, and it did kind of remove the thought of silo or individual services and programs that were just kind of scattered amongst Oregon that I had to look for. But I will say that calling it a community of care, or collaboration, or something along, if we change the way that it was given to families and explained to families and explained to any caregiver for a child, if it was explained in a different way, I think the understanding and the receptiveness to the programs available would change quite a bit. So I really think that changing the terminology, especially when the information is being communicated to families, I think is an important thing. Like I said originally, when I hear the word system, I have a reaction, because there is a major system that comes to mind for me, and that would be self-sufficiency programs and also child welfare system. And so when you have an automatic response like that, unfortunately, sometimes you stop listening and you go on the defensive. So I think it's really important to think about not only how we communicate to families, but when we communicate to families as well, because a new family coming into services is going to already be overwhelmed and managing a lot of things. And so the time frame in which we discuss what programs are available, I think, is also important.
Yeah, timing and the way it's defined, those are huge, and it can impact how someone views their role in a system, or in a system of care, community of care. The philosophy behind it, as you said, it is relevant, but are we sharing that? I kind of feel like, having been involved in system of care for the majority of my career, at least the last 20 years, I feel like we kind of come full circle every so often. We do a good job about letting people know what that means, but then we don't continue that, and then we do it again, because the philosophy is very relevant, and the idea of doing business together and streamlining things and having it fit families and youth that are seeking supports, not having to fail up, just making processes simpler, accessibility, all those things, they do make sense, but we do have to keep reinventing that, and saying, this is really what that means. So you brought up a good point about the communication. And so I'm curious, Jax, from a young adult standpoint, how is it communicated to you what this means and your role in it? Yeah.
So I was for a couple years the youth of the family that had to get the services, and I remember during that time it had not just been concerned between if there were other services that needed to be communicated with, but the fact that even just within the small mental health system that we had been navigating, there seemed to be a lack of communication. And so when I had started to be involved with a youth-led organization in my county, and had an adult that was running it, kind of for us, because we were all in school, reach out to me and ask if I wanted to help with the system of care. I had a lot of hope for that, because from my experience, it felt like there was a lot of potential in making sure that everyone was able to communicate with each other. But I don't know that it's anything even my parents have heard outside of what I've talked to them about, which is interesting now, because I have another family member that's had to start navigating different kinds of services because she needs some, and she has a child, so it becomes a bit more complicated. And now that I see that, I see my parents constantly struggling between calling representatives from different services. And I don't know that they've seen the kind of communication that they've needed as consistently as they've needed it, which is a concern to me.
And communication keeps coming up as, and really that's what we're talking about. As Catherine said earlier, it's about partnerships, and partnerships are based on good communication and trust and follow through. And it seems like this is an area that maybe needs to be worked on, as we try to implement more coordinated, collaborative processes for serving and including youth and families in the work in behavioral health. We talked some about, some of the things that you've said might be a better way to deal with things. In doing this work, I often see it as the capitalized S&C system of care, so capital SOC as opposed to lowercase system of care SOC. So I think of capital SOC as the grant fund, the more formal, there's an infusion of money to be able to start building that foundation and making those changes and having hope for changing processes and including youth and families in all the work. But the little SOC is really the work. I mean, you don't have to have seed money for that. It's about communication. It's about working together. And Jax, you pointed out that even within like a small mental health community, there may not be communication going on. So I'm curious from each of your perspectives, what would you recommend? I mean, what's a better way to convey this philosophy and these values that we all want and we want to see implemented? What do you think that we can do to move from a system of care to a system that cares?
I think informing that authentic partnership, it's really along a continuum of how do we get there, right? And so communication has come up a lot. And I think so that's part of it. Where's the connection that we have with systems and that systems have with each other, right? What's the communications that are occurring within those connections? And is that allowing us to collaborate and empower families and youth? So I kind of think of the 3 C's of connection, communication, and collaboration, so that families and youth are full partners at from direct service to guiding, programs, policies and whatnot.
I love that, the 3 C's. Connection, collaboration, and communication. That's kind of come up through the word cloud, through our discussion. It's a good way to put it, Catherine. What about you, Rainey, and Jax? I mean, what are some ways that we could move forward in having people understand what the little SOC is?
I guess from my perspective, changing system would be a huge part of that, in my opinion, just because, as a family, that word removes your power. It removes your voice. It removes, all of a sudden it becomes a power play. So you start to be quiet and listen to what you're being told to do, instead of being able to speak up and say, this is my family's values, or, what I want for my children, and things like that. And so I know that we've talked a little bit, and there's been programs, programs that care, and things like that.
Mm-hmm.
I even just think using the word services, family serving agencies, or, something like that puts the family back in the driver's seat, or the youth, or whoever is receiving those services. I have a 13-year-old who's his own best advocate. And I just support him and let him speak as to what he needs. And so it's not even really, the caregiver that should feel empowered by the word. It's a youth who's speaking for themselves, or, and I think that, agencies that care, or programs, something along those lines, that really does remove the power play, and the it removes, I guess, the sting of what comes to mind when you think about what agencies are there to help your family, because every agency that plays a role has a purpose, and it's there, and it has, an idea of how it's going to serve families. And so even just agencies that care, or something like that, I think would be more helpful and more beneficial. But it definitely needs to be something that empowers families and youth, whoever's getting services, adults who need services. They should be empowered that they still are the driver of their own life, and they're not being told, this is how you need to do this thing, because every family's culture is different as well.
So having anyone who's working with youth and families, having that understanding of that perspective, that youth and families have come through systems, and that is more of a negative connotation, having that understanding might help some of the communication, and might help some of the ability to partner with each other if you can see somebody else's perspective. You said something that really just kind of struck me. I had not thought of it this way before, but I would like the term system of care, because I really truly believe in the philosophy and the principles and the values of it. I want that to be empowering, and to me, it's supposed to be. And I think if you ask Beth Struhl, she would say, yeah, it's supposed to be empowering. I'm part of a system of care. And in different areas, maybe that is the way it is. But I think it does come down to understanding that it's not always perceived that way. And how can we communicate? How can we put that power back? So thank you for sharing that, because that was a new way of thinking about it for me. Jax, as a young adult, what do people need to understand to help define this and bring you in as a partner?
So in terms of defining it, I think that as all three of you have said, there's that one word that sometimes feels like it needs to change from systems to communities or agencies, just so that people outside of working in a system and being comfortable with the language that comes with that work can hear it and understand that it's something more collaborative than like a machine, as Catherine had mentioned, that moving from feeling like it's a machine to feeling like it's a community. And when it comes to youth, there's kind of that, how much more do we need to have control over our lives? Because in many cases we do. And there are a lot of situations where youth are not given the power that they need to get what they need. And then there's the complication of how much do we know, where we often put our trust in someone with a lot of masters or PhDs, and sometimes they let us down. And then we question if we should do that again, when in many cases we need to, because we don't have that experience or that education to lead ourselves where we need to go. But we've also had the pretty terrifying experience of trusting someone that in many ways should be able to help us get where we need to go. And when it comes to telling the broader community what system of care is and how much it really can help them when they do need different services, I feel like we're starting to see more inspiration of how to do that in the different activism that has really come out of COVID, where people are constantly trying to communicate all these ideas and different actions that people are taking and want others to help them take. And I feel like there's a lot of potential in looking at what has started to become popular and what people have started to look for in an organization, and seeing what different systems of care or communities of care, maybe we can move to, can start to implement to tell the community that they are there for them and that they are trying to make it easier for them.
I love that you are pointing out the possibilities and the innovation that has come through challenges. And I believe there's always, an opportunity within challenges, and so that really resonates with me in particular. But it's interesting that if you could take those, the things that people are trying now to try to increase communication and reach out and connect, and apply that to the bigger picture ongoing, we really could change practice. Telehealth, is something that's increased, and being able to meet virtually like we're doing now is an opportunity to engage even more, and in different ways. So thank you for that. Is there anything else that comes to mind about a different way to approach using this term, or suggestions? Because there may be some that the term system of care, works for them. So I think it is probably specific to individuals and to communities. Catherine, have you seen a difference in using the communities of care and how people get involved?
Yes, I do think that communities of care, at least within our local neighborhood outreach councils, has had a positive impact. People still want to learn more about what is a community of care, right? So whether it's system of care or community care, what is that? And so really just being able to describe to folks how they can be a part of impacting their care or the care of children in their community has been really important. I think, whether we call it system of care, community of care, partnership of care, it really is about what we practice and how we build that out. So let me show you, right? Like it's not necessarily the easiest terminology to, or you can explain the philosophy, but what does this look like in practice? How can we demonstrate this on a small, just in a small way, with every youth and family that we connect with? How can we ensure that our values are here? And so they, whether they know the term system of care or not, that's their experience, and they're getting what they need and what they want, because we have that equal and equitable partnership. I thought it was interesting, both Randy and Jax had referenced the power dynamic that comes with systems or system of care. And so when you have a partnership, it's not enough that we just have a partnership. We need to have an equal partnership, right? So the professionals and the providers, they have their expertise and what they bring to the table, but the family and youth have their lived experience and their knowledge of how this is going to work for their lives. Because ultimately, I don't know too many folks that want to be involved in systems forever or want services forever, right? Yeah, so it's how can we support you in accessing what you want so that you can go on to live your best life.
I think you sum that up nicely. The words do matter, but it's the practice that follows up. And sometimes, as we said before, the words that you use can open people's ears. It can influence practice. So thank you for that. And thank you, Jax and Rainey and Catherine, for sharing your experiences and your expertise with us today. We have we kind of want to close out each one of our sessions with going back to what that term was that we first started with. So before we go, let's return back to those initial perceptions and thoughts about the term system of care. We've all kind of mentioned some of the things that have come up on that initial word cloud. But I want everybody who's listening and who's been interacting on Facebook and in the chat box, consider what you've heard now and what you've learned from the experiences that were shared today about system of care. And think about that for a minute. What are some of the things now, having heard this, are you committed to doing to move your system of care to a system that cares, a community that cares, an agency, a program, as an individual in your work? So I'm going to ask Joanne to put another link in the box, the chat box. And this poll is going to be a little bit different. What are you willing to commit to? And it's going to start rolling across what your responses are and the different commitments. And so go ahead and start answering that. And what we want to see is there a change here in tone or in perception or thoughts that are different than the first poll that we did today? So if you're able to go to menti.com, and the code is 6879-9291. Representative services. And Jax, Catherine, and Rainey, feel free to comment on any of these that are coming up right now. Making sure it's visible that you do care. Those actions.
I love it. I see speaking up and not giving up, because our systems, they may either be broken internally or broken across systems, and so we do need to speak up to get that communication going.
Yeah, I don't think anybody gets into this work to do harm. I mean, we all get into this to help someone else because we have a heart for helping. But a lot of times, protocols, we get so focused on process that we kind of miss that.
I really love, as I'm watching these come in, making sure that the families are listened to and that they're actually engaging as part of their care plan, being more intentional about the inclusion of family perspectives, voice, and ideas. You know, as a mom, I don't know. We've been in services for like 6 years. And so it makes me really excited to see that. And then how it's explained to families also was something yeah, nothing for families without families, ensuring families are at the decision-making tables. An agency that I worked for, OFSN, one of the phrases was nothing about us without us. And, you know, as a family, to give the family the power of knowing that no one else is speaking about you except for you, and that you're there at every conversation that's happening about your family. I think that that's incredible.
I love be radical about engaging youth and family voice. That's got to resonate with you, Jax. Be radical about it. You know, get out there and talk. Be willing to have youth and family voice at the table, and you're going to hear something different. And we need to hear something different.
I also feel very excited to see all of this about ensuring more communication with the people receiving services and the people offering them, because I have seen even in the governance council for my county, there have been situations where it becomes a very difficult conversation, where sometimes the provider might be criticized because they did something that was really unhelpful, and it can be hard to hear that and to then adjust and improve without feeling like you've been shot down, even when that wasn't the intention.
Feeling to have.
I love whoever wrote the continue to focus on the upstream processes so that children and families get what they need before they get to crisis. Absolutely. You know, how are we supporting behavioral health and wellness for all of us, right? How are we supporting that resiliency in the community? What is the relationship with behavioral health in the community? And so I think I really appreciate the nod to prevention work there and early intervention to just let's get connected and get the access earlier on before we're in a crisis or in a deeper end situation.
And of course, youth and family peer support providers, strong support and pay. That's near and dear to my heart, whoever put that in. Explain terms and concepts. I mean, I think one of the things that keeps going through my head are the 3 C's, Catherine. That just is, it really does kind of sum it up. Continuation of services. Thank you everyone for joining in on that exercise. I think we do see a difference in the tone and in maybe some action, intentionality toward addressing how this particular term can be perceived by other people, which is sort of the point of this. So thank you, Joanne. So thank you everyone for joining us today. And we hope that you have heard something new that has impacted you. And we hope that you'll join us next month. We're going to explore the term serious emotional disturbance, SED. So in closing, we challenge you individually as organizations and programs, whatever your role may be, to be intentional in using terms that are more supportive, that are more respectful of the youth and family experience and expertise. So thank you again, and just remember that words matter.